September is Prostate Cancer Awareness Month, and prostate cancer is the #1 cancer in men. In the United States, there's about 160,000 new cases each year. So joining us now to talk about this, two gentlemen from Middlesex Hospital, the radiation oncology chair, Dr. ANWAR Khan, and urologist at Middlesex Hospital, Dr. Ed MYER, because there are interesting things that Middlesex Hospital is doing to try to fight it. Gentlemen, thank you both for being here today. Dr. MYER, we'll start with you.
Thank you for having us.
Yes, glad to have you here because we want to try to get the word out about prostate cancer. I think most people have a very vague understanding of what it is, but what can you tell us about the symptoms and sort of what segment of the population it tends to strike?
It tends to strike older males. The average age of diagnosis is 65, and there's a huge range of prostate cancers out there. From very slow-growing prostate cancers that are never going to cause a problem to very aggressive prostate cancers that will cause problems no matter what we treat them with.
Yeah, which is odd. I've heard the term with prostate cancer before that in some cases, as you said, you can die with it, not from it, which is odd to hear. But I imagine in some cases they all share a lot of commonalities in terms of the symptoms. So what should guys be on the lookout for?
Well, generally, early prostate cancer is completely asymptomatic.
Okay.
So there are no real symptoms to look for. You can look for some lower urinary tract symptoms, such as a slow urinary stream, frequency and urgency of urination. But to tell you the truth, more often that indicates just benign enlargement of the prostate. More advanced prostate cancer can show up with obstruction to the bladder. It can show up with back or bone pain or abdominal bloating and pain.
Okay. Is there a test that I've heard of the PSA test before? How does that help?
Prostate cancer screening is done in two ways.
Okay.
PSA is a blood test for the prostate, and although it's specific to the prostate, it's not really specific to prostate cancer. So there's a lot of gray area with PSA. But that having been said, it's really the best screening test for prostate cancer that we have, and also a rectal exam, because a rectal exam can tell us things that a PSA can't sometimes. Sometimes you can have prostate cancers that are growing that don't make PSA, for example, and we can tell there's a prostate cancer just by a nodule on the prostate.
Okay. Now, when it comes time to treat, if that is the appropriate course of action, there's something new Middlesex Hospital is doing, at least new to me. I've never heard of it before. Dr. Khan, you can talk about it. It's called SpaceOAR, and I guess it's a way to make radiation more effective?
Correct. I mean, radiation therapy is very effective for prostate cancer. It's one of the two main treatment modalities, either surgery or radiation. They both work well for early-stage prostate cancer, but if you have more advanced disease, radiation typically is the way to go.
Yeah.
We have been using it for over 50 years now, and have come a long way. There's algorithms, the software, the hardware has become very sophisticated, but we're always looking for things to improve. This new system called SpaceOAR system, which stands for Space Organ at Risk, is something it's a hydrogel that's injected between the prostate gland and the rectum. The two of them are anatomically very close together. It creates a little space for the radiation oncologist to do our job better. This way we can target the prostate and minimize random dose to the surrounding organs, especially the rectum. We are offering this product at both our Middlesex centers, the one in Middletown as well as the one in Westbrook. And we think that it will allow us in the future probably to also accelerate the treatment rates, so be able to deliver the treatment over shorter periods of time.
Well, that's good to hear. You mentioned Westbrook. While we have you here, please tell us about the center down there. That's relatively new.
So Westbrook Center we opened last October. And the main thing was to try to make it convenient for our patients in the Middlesex County who had to otherwise travel to Middletown. Now they can be treated locally, and we have the same equipment. It has all the same services offered. So it has made a big difference. In fact, all the testimonials we're hearing from patients, even in less than a year, that it's making a big positive impact in their lives.
Wonderful. And again, the SpaceOAR system is available at both Middlesex and down in Westbrook. Dr. Khan, Dr. MYER, thank you both for being here today. A pleasure to meet you, sir.
Thank you for having us.
Glad to have you here.